If your blood sugar is high even though you eat healthy, you are making a mistake, and no, it's not because you're lazy or cheating. It's because one healthy habit you trust is silently pushing your blood sugar up every single day. And most people never realize this until damage has already started. Which is exactly why so many patients look at their reports and ask, "But doctor, I removed sugar, I eat healthy, so why is this still high?" And that frustration is real, because when you're genuinely trying your best and still failing, it feels unfair. And today I want to be very clear and honest with you, not emotionally but medically, about what's actually happening inside your body. Because blood sugar problems are not caused by sugar alone. They are caused by how fast glucose enters your bloodstream. And a blood sugar spike is simply a rapid rise after eating. But repeated spikes are far more dangerous than slightly high sugar because they silently damage nerves, kidneys, eyes, blood vessels, and the heart. And here is the uncomfortable truth that most people are never told. Many people spike their blood sugar while believing they are doing everything right, especially when they rely on foods that are labeled as healthy. Because foods like brown bread, oats, fruit juice, honey, dates, and smoothies may be nutritionally healthy, but medically many of them convert into glucose very fast, and your pancreas does not read food labels or marketing claims. It only reacts to how quickly glucose floods your blood, which is why someone eating clean can sometimes spike higher than someone eating less. And this brings us to a trap I see constantly: portion size, because when a food is healthy, people unconsciously eat more of it, and that is where control is lost. Since even healthy carbohydrates in large portions overwhelm insulin, whether it's 2 bowls of rice, 3 slices of brown bread, or a large smoothie, each one alone may seem harmless. But together, they push your blood sugar over the edge. And this is why most people don't actually have a sugar problem. They have a quantity problem. And another mistake almost no one talks about is eating order. Because if you eat carbohydrates first, sugar rises fast. But if you eat vegetables and protein first, sugar rises slower. And this is not opinion or a trend. This is basic human physiology: the same food, the same calories, but a completely different sugar response. Yet even if your food choices and portions are perfect, blood sugar is not controlled only in the kitchen. It is also controlled in your nervous system. Because stress hormones raise sugar and poor sleep creates insulin resistance, which is why some people wake up with high sugar even without eating anything, as the body reacts to survival signals, not diet plans. And this is also where many patients misunderstand medication. Because medication is not magic. Skipping doses, changing timing, or stopping medicines because sugar felt okay creates instability, and instability causes spikes. Whereas the best control happens when medication, food, sleep, stress, and routine work together rather than separately. And if you're wondering what actually helps, not extreme diets or fear-based rules but real medical logic, start by reducing portions even of healthy foods. Eating fiber and protein before carbohydrates, avoiding liquid calories, walking for 10 to 15 minutes after meals, protecting your sleep, and managing stress because it matters more than most people realize. And these small daily habits protect organs far better than perfect diets followed briefly. And before I end, I need to say clearly that this video is for educational purposes only and does not replace personalized medical advice. So always consult your doctor for individual treatment. But if this explanation helped you understand your blood sugar differently and more clearly, subscribe to Medical Truths with Dr. Nimra for honest, evidence-based health education. Comment below which healthy foods surprised you the most. And share this video because someone you care about may be unknowingly harming their health without realizing it.